In this presentation, a type 4-2 A1 fracture of the tibial shaft will be stabilized using the large external fixator in a uniplaener double rod frame. The objectives of the exercise are to understand the clinical indications for the application of the large external fixator, the choice of frame type, the positioning and correct insertion of the shunt screws, and the construction of the uniplaener double rod frame. The most important indications for the external fixator include fractures with severe soft tissue damage, either open or closed, including fractures of the tibial diaphysis and intra-articular fractures, for damage control surgery in polytrauma patients, and acute and chronic infections in both fractures and non-unions. Either a modular or a uniplaener frame is selected. In this exercise, a uniplaener double rod frame will be applied. When using this frame type, the limb must be aligned before the application of the frame. The instruments needed for this exercise are the compact air drive, the quick coupling, the drive adapter with quick coupling for 5 mm shunt screws, and 4 125 mm long 5 mm diameter self-drilling shunt screws with a thread length of 40 mm. Conventional shunt screws may be used as well. Also needed are the handle for drill sleeves, the short 6.0 5.0 threaded drill sleeve, the short 5.0 3.5 drill sleeve, and the short 3.5 trocar. The universal chuck with T-handle may also be used to advance the shunt screws. For the construction of the uniplaener double rod frame, 8 large, MR-safe, open adjustable clamps, and 2 300 mm long, 11 mm diameter carbon fiber rods are needed. To tighten the frame assembly, an 11 mm cannulated socket wrench and the 11 mm combination wrench are used. An anteromedial position is recommended for the placement of the external fixator. The shunt screws must be placed in the safe zones and in the same plane. Here they're shown in position with the fracture reduced. In general, the shunt screws should be placed medial to the tibial crest. This placement is particularly important in the distal tibia to avoid interference with the tendons and neurovascular bundle. The position of the frame should not interfere with access to the wound for the initial debridement. The tibia is secured in the clamp with the fracture provisionally reduced. After a stab incision is made, the drill sleeve assembly is inserted through the incision and placed directly on the bone's surface. The trocar is removed. Since self-drilling, self-tapping shunt screws are used, the drill sleeve also is removed. A shunt screw is inserted into the adapter. The power drive is used to advance this first self-drilling shunt screw through the threaded drill sleeve until the tip is anchored in the far cortex. In the clinical situation, irrigation is recommended while inserting the shunt screws. The second shunt screw, which is introduced in the distal fragment, must be positioned in the same plane as the first one. Once a shunt screw has been placed, it's released from the adapter, and the drill sleeve assembly is removed. The image intensifier is used to check the final position of the shunt screws. The large open adjustable clamps connect a carbon fiber rod to the shunt screws. The nuts are first tightened by hand. The socket wrench is used for additional tightening. Using the image intensifier, the proper limb alignment is verified before final tightening. Final tightening is completed with the 11 mm combination wrench. Two additional open adjustable clamps are attached to the carbon fiber rod. They are used to hold the drill sleeve assembly as the shunt screw is inserted. The trocar and drill sleeve are removed. The shunt screw is inserted into the adapter. Again, the power drive is used to advance the shunt screw through the threaded drill sleeve until the drill tip is anchored in the far cortex. Once the shunt screw has been placed, it's released from the adapter, and the drill sleeve assembly is removed. The procedure is repeated to insert the second shunt screw in the distal fragment. After the insertion of the shunt screws and the removal of the drill sleeve, the clamp nuts are tightened. For additional stability, a second open adjustable clamp is connected to each shunt screw. And a second carbon fiber rod is snapped into place. The clamp nuts are tightened. After final tightening with the wrench, the fixation is complete. This presentation has demonstrated the choice of frame type, the positioning and correct insertion of the shunt screws, and the construction of the uniplaener double rod frame.